Hello and welcome to Medcurity Live. I am Joe Gellatly.
I'm Amanda Hepper.
Today we're talking about the coronavirus. Have you heard of it? Kind of a big deal right now, just a little. We're going to talk through, we'll lead out here with something that you were, Amanda's sharing an interesting way to track and keep an eye on coronavirus and its impact around the world.
There is a young man named Avi Schiffman out of the Seattle area that wanted to solve a problem, and that was all of the misinformation going on with the coronavirus. So he took matters into his own hand and late last year developed a website. It's ncov2019.live. So if you want to go to that website, you will have access to this. So he is scraping, every 10 minutes this website is being updated. And so he's scraping well-sourced other sites and populating it with this. So it contains the total confirmed cases at any point in time, confirmed cases outside of China, the deaths associated with this, total recovered, so people that have recovered from the coronavirus, and then total countries infected. So there's stats for mainland China and then for every other country that has been impacted with this. And so he also has provided a map. So he's invited other people to give information to this site, and so another group of individuals developed this map that Avi added to this. So you can literally go to different areas of the world and see where they're at. Whoops, I made that a little small.
Wow.
Yeah, isn't that cool? So there's little green hearts that show people have recovered, little black skulls if there have been people that have passed away, and then what is going on with it. And then if you click on these little dots, it brings you to the source of that information, which is very handy. So you can log on and get access to this information. He also has provided information from other sources like Center for Disease Control on what is the coronavirus, what are symptoms, what to look for, watch out for, how to protect yourself, and preparation. And he got this from the It's Just the Flu site, and I looked through this and I thought it was just awesome. What to stock your house for in various rooms, dry food, get prescription medications ahead of time, and also pet supplies, which I thought was awesome. People may not think about that, right? So this young man is also doing Running Start. One thing that I thought was actually adorable is this is free to everyone, but if you would like to donate to the cause, you click on the Buy Me a Coffee button, and then you can donate $3 and buy Avi a cup of coffee to fund his endeavors. Yep.
This guy's got a future in business intelligence, doesn't he? Or many other things. That's so cool.
Yeah.
Well, as we track this and look at coronavirus from our lane in privacy and security, we thought we would share a couple updates on what does our privacy as patients look like in an event like this, or potentially a pandemic, right? So we want to begin just real quickly with restating in the privacy rule what is actually allowed. Right now in the privacy rule, your patient information can be shared for your treatment or the treatment of another. So your protected health information can be shared for the treatment of another individual without your permission or authorization, which opens this up, right, to say this is for the sake of the community. We need to share more information than maybe you would have signed off or wanted to disclose, because we need people to know that this virus is here in the community.
For population health, right?
For population health, yes. In fact, it's wide open in the privacy rule to share this information with the state, the CDC, of course, and your local health department as well. So that's all allowed already. Excuse me, talking about it is making me cough. So we have that opened up. We also are watching, because if the Department of HHS, Health and Human Services, declares a national health emergency or regional health emergency around this, they can begin to waive specific provisions of the privacy rule. So HIPAA doesn't go away, but some of the things we have, the rights we have to decline having our information listed in the public facility directory, to require private communication or restrict things from our record. All these rights that we have, they are allowed to be waived by the secretary in the event of an emergency, so that could get interesting as well. But in the short term, they do have the right to share with agencies with very limited information, of course, with media, everything under the umbrella of minimal necessary. Right. So, what do they need to share to help prevent imminent threats to the community? That's all allowed right now.
So, what can be done if somebody is very ill, they're brought to a clinic or a hospital, and maybe it's a friend that brought them, but they need to get information, they need to share information with that person for their care. What are the steps, or what can be done with that?
They need to share information with...
Well, like a loved one or whatever,
yeah,
for that person. So,
yep. So they have the right to share information with someone who is the care provider for that person.
Yep.
So that is open already. Other considerations would be maybe that person is potentially exposed. So that would be a reason they'd want to share and say, this is what we found, this is what your risk is.
Right.
We're going to take you to this private room now.
Right.
Take you to some isolation. Yeah, take you to an isolation place here. So there is some great guidance from the federal government. Actually, they released great clarification back with the Ebola outbreak, and it's very relevant. So if anybody's interested in diving into it, drop us a comment or let us know. We're happy to share that, of course, and track what the appropriate way to proceed with this is. But fortunately, there's been a lot of planning with our health departments and agencies, and so I think they know what to do here. We'll follow the directions, we'll follow the map. Stock up on toilet paper, apparently that's the thing that everybody's doing. Dog food, yes, and buy the kid a cup of coffee.
Yeah, buy the kid a cup of coffee. So it also points to having emergency operation plans, right, for clinics. I mean, if in a clinic people are getting sick, right, so that they may have to implement their emergency operations plan, which is part of Hepper.
Critical, yes.
Yeah.
Yeah, it's not just for disasters that you may think of being far removed from what might actually happen,
right,
or IT issues, but in the case where perhaps you have staff,
right,
getting ill and not being able to be in, or
right,
out of commission, how do you sustain those operations?
Right.
It's an important part of the plan.
Yep.
And this is why we spend all the rest of the time talking about preparing and preparations for events like this.
Right. Better to have it in place and hopefully not have to use it, right?
Yes, yeah, for sure. So we are attending a conference, National Health IT Conference, next week, and so that's been interesting to watch through the filter of preparation for coronavirus. They've taken handshakes off the table. What are we supposed to do now? Yeah, there you go. The HIMSS elbow bump. So that's HIMSS. It's going to be pretty fascinating to be there. It always is for people that are in this industry, and so I'm excited to be a part of it this year. The President of the United States will be speaking there, so it doesn't look like they're canceling it, despite some of the fears about the virus.
Yeah. Potentially 45,000 people.
Wow.
Yeah, it's going to be awesome.
So we may have some good reports from that. In the meantime, wash your hands, and thanks for watching.
Yeah.
And we will see you next time here on Medcurity Live.
See you next time.